I'm going to clap.
Okay. Is that to get us?
Do you know why?
No.
Because this is the last chapter.
Yoo-hoo!
Just kidding. All right. So we are making our last video of the day. Again, this is information from last week's material. We want you to be familiar with it. This material centers around the GI system. So we're going to talk about constipation, diarrhea, nausea, vomiting.
All the things you're probably experiencing right now listening to.
No, that's just before a test.
Oh, okay.
Yeah.
All right.
They probably are sleepy when they listen to us.
Yeah, that's true.
All right. So let's, the medications that we want you to know about: Metamucil. We want you to learn about stool softeners, Docosate. We want you to learn about stimulants. We want to learn you. Oh my word.
We're going to learn you.
I'm tired. So we also want you to learn about anti-diarrheal medications like Lomatil.
Or Imodium.
Imodium, yes. All right. So moving forward, I'm going to go to the next page. You can read a little bit about the normal GI tract.
Remember, the big take-home message right here is that everybody poops differently.
Yes.
Some people poop 3 times a day. Some people poop once a day. Some people poop once every 3 days.
What about once a week? Just kidding.
Yeah. Let's hope not.
Let's hope
They'll
not.
probably explode by the end of the week. But anyways, so, when your patient tells you that they haven't had a bowel movement in 3 days, you need to follow it up with, is this your normal pattern of having a bowel movement?
You are so wise.
I try.
You impress me.
Oh, thank you.
I love it.
Thank you.
But now, how many people have experienced constipation? Put up your hands.
Oh, yes.
Oh, that's a lot of people.
That is
Look
a lot
at
of
them
people. Wow.
Wow.
Woo!
Everybody's had constipation. Obviously, this is general information you may have experienced or been exposed to. We all have lots of different bowel patterns, but there are medications that we do give to enhance defecation, and so some of them are very powerful and they are stimulating, and some of them are very soft and gentle. So over here, the medications we'd like you to be more familiar with are bulk-forming agents.
Like Metamucil?
Yes.
They bulk up your poop?
Stool softeners or surfactants known as Colace or Docosate. And what I love about the name Colace is I always tell people it lines your colon with like jelly and prevents water reabsorption. And in doing so, it helps keep the water in the stool, which then makes it easier to pass.
There you go.
Stimulants obviously increase peristalsis. And we won't get into too many osmotic laxatives.
But remember, if you increase peristalsis, they're going to feel crampy.
Yes.
So that's why sometimes that Dulcolax, they may complain that they have some gassy cramping.
Yeah, so here they are right here, some examples of common names for each category. And the medication, there it is, Bisacodyl or Dulcolax. It's a stimulant, and it can cause cramping. So prior to giving this medication, it would also be important to ask them, have you had any abdominal cramping? And what else would it be important to ask?
Well, let's listen to their bowel sounds, too. Because, if they have hyperactive bowel sounds, I'd be thinking twice about giving them something like that.
You know what? I've seen people actually continue to give stool softeners and stool laxatives without asking when their last bowel movement was.
And this is the thing. You have to ask. Remember, it's assessment. Assessment comes first.
Yeah, assessment before the intervention.
So you go in and you ask the patient. So that lactulose, it's always on the med sheet. They're going to get it, BID.
Maybe they don't even know they have it.
Well, that's the thing. They don't. So you need to go in and ask them, when was your last bowel movement? If they say to you, well, let me see, I had 2 bowel movements today, you might want to hold that lactulose.
Definitely. But I've seen people give it because it's on the MAR, it's ordered, and they go, oh, well, it was ordered. And so unfortunately, they cause electrolyte imbalances.
This is true.
Or dehydration and all that other fun stuff. So ask before you pass.
Now, remember, too, the stool softeners we generally give to anybody who's on opiates.
Yes.
So if they're
Can they name an opiate? Do you think they can name one?
Let me see.
I hope you guys can name an opiate. Those are your medications for pain.
Yes. So if they post-op, or maybe they're having some sort of pain and they're getting all those different
narcotics,
opioids, then they'll often be on something like Colace prophylactically.
Right. So it'll be there, ordered. They may not take it at home, but it'll be a new medication because we anticipate they might experience constipation.
Oh, and then there's the patients maybe that have had an MI.
Yes. We don't want them to strain. Yes.
There you go.
Very important. No straining.
Maybe they've had cataract surgery.
Oh, exactly. No straining.
So we don't want all these reasons why you might have to be on some sort of.
And there are natural ways to promote defecation as well. So you don't necessarily have to get to medications.
This is true.
Fiber, prune juice,
water. For some people, coffee and a bran muffin. That was my mom's thing.
For some people, it's just regulatory like clockwork every morning. Right. Yeah.
When you get old.
Bran muffins. All right, I'm bringing you a bran muffin tomorrow.
Oh,
I'm not saying you're old. Bring me a bran
old.
muffin.
It's okay. I'm old. You
No,
can
no,
say it.
that came out wrong.
No, it's okay. I'm old. I'm old. I'm over 50. I'm old. I'm ancient.
Too funny. You are not ancient. She's got more energy than me.
Yeah, I don't know.
All right, so the nursing process with laxatives are right here for you. Very important. Hold any laxative therapy unless it's ordered, and hold laxative therapy if your client is having any signs and symptoms of loose bowel movements. That seems obvious, but it needs to be said. Obviously, it's given to relieve constipation, and sometimes we'll order a laxative or an enema until clear for diagnostic procedures and whatnot, and we'll need to explain that. All right.
And it's kind of like the whole, the patient is like pre-hypertensive where you try and change their lifestyle. It's the same thing when the person says they're not maybe having regular bowel movements. You don't want to just go ahead and put them on stool softeners. You want to increase the fiber in their diet, get them to drink plenty of water.
Yes.
And that's
get them walking if it's tolerable, or if it's not, unless it's contraindicated, which it's not usually, but there are clients that can't get out of bed, so that's something to think about. And the opposite of constipation is diarrhea, and so we have to deal with that. Too much of a good thing is a bad thing, so I want them to recognize that too much of these medications can cause the opposite effect.
Yes.
And so anti-diarrheal medications, if you've never given one of these, chances are you will be shortly. And again, hold these medications if your client is having formed stools. If they're having formed stools, that means the next time you go to give it or the next time it's working, chances are you're going to cause constipation and straining, and we don't want to do that.
Right. On the Imodium label, it says to take 2 tablets after the first loose stool and then 1 after every loose stool. But you got to be careful because there's a fine line between diarrhea and constipation. So you want to tell the patient that they need to allow for the drug to work.
And also, it's important for them to maybe look up the term toxic megacolon, ulcerative colitis, and Imodium.
Oh, yes. There you go. That would be important.
Go ahead and pause the video and go look at some Google images of that and understand a little bit more about that and bring questions to class.
The other thing to remember with, if you look at page 518 where it's talking about the antidiarrheals, it says the most effective drugs for symptomatic treatment of diarrhea are the opioids. So we've talked about those drugs like morphine and Percocets and all that kind of stuff and how they do cause the colon to slow right down. So it would make sense that if a patient's having diarrhea, you could give them an opioid and it would have the same effect. So that said, if you look at your table 37-2 at the top of 518, and it talks about the opioids, so you've got belladonna, you've got Lomotil and Imodium, they do tend to make a patient sleepy.
So they're at risk for falls, risk for constipation.
Right. But if you have the stomach flu and you're taking Gravol and Imodium, it's a really good thing because then you just sleep through all that horrible.
And you don't remember it. All right. Which page are we on now?
Okay, so now we're moving over to nausea and vomiting. We just go from one great subject to the next. So that's 519. So
again, more symptoms that they might experience when they are about to write a test for pharmacology.
Yes, this is true.
I hope not. But nausea, obviously, most of you may have already experienced an episode of nausea in your life. You probably had the flu or whatnot. There are medications that we do give for nausea. These medications typically put a client at risk for falls and sedation. So think about your health teaching and general interventions to prevent falls and any harm that could result of being over-sedated. What medications or substances do you not want to mix? And I think that's over here on the next page. So for here, report any signs. So this one's clients receiving antidiarrheal therapy. So the nursing process here. I want to go down here to that client education. This is very important information. Anything else that we want to talk about?
Let me see. What else we need to talk about? So nausea and vomiting, we see it with the flu, but as you've noticed, I think Professor Mears and I talked about this at the beginning of the semester. Just about every medication out there, a side effect can be nausea and vomiting.
Yeah.
So some medications, especially those associated with cancer, do tend to cause nausea and vomiting. So if somebody's on chemo, they'll usually be given a drug like Zofran. Prophylactically. So that's because some people actually get anticipatory nausea and vomiting. So just my sister-in-law had a leukemia. And she said all they had to do was stand at the door with her chemo bag and she would start vomiting.
Yeah.
So,
So, and again, these medications, they act on the brain or the center of perception for being upset, vomiting over here. We also, where is it that we read about the neurotoxins for food poisoning?
Find it where it stimulates the neuron. The neurons can sense. Where was that? The neurons. This is something that we learned that we didn't know. The neurons can sense when there is something in the
toxins
blood.
in the
and it triggers the vomiting center in the brain and will cause you to start to vomit. I forget where I saw that.
That's okay. We'll move forward. All right, antiemetics, so anti-vomiting. Here they are here, and keep in mind that any number of these medications may be ordered by a doctor. And you'll want to be familiar with the purpose of the medication, so you offer it for your client, whether it's prophylactically or scheduled. And then you also want to take into account any nursing interventions that help maintain safety.
Yes.
All right, so here they are right here. Use assistance when getting out of bed. Make sure they have their call light. Avoid performing hazardous tasks, especially if the sedative effects of the medication are not well known. If there's any vomiting of blood, then that needs to be reported immediately. So I would think that would be pretty important, that if there's any episodes of vomiting and blood, that needs to be reported immediately. We're not going to talk about the weight loss medications here. So we're going to skip right over that. And the last thing that we just want to touch on, so you can skip over weight loss medications. That's not anything that we're going to talk about. Pancreatitis. Just maybe have a read on pancreatitis, but nothing too great. You're going to get more of this information in which
I think it's 309.
Okay.
So third semester.
So you can read a little bit of pancreatitis. Again, I think it's important for you to know the functions of the pancreas for as a nurse, not necessarily right now for this course. And then a new word. Maybe you want to learn the word here, steatorrhea. And kind of sounds like diarrhea, but
it kind of does.
Steatorrhea.
And steatorrhea we're going to talk about a lot in pediatrics because patients with cystic fibrosis have steatorrhea.
And so one of the medications we do give if your pancreas is impaired or damaged or diseased is pancreatic enzymes. So these medications are, it's important for nurses to know that we sprinkle this enzyme on their food. And again, the medication ends with A, so you know it's an enzyme. And clients need to be educated to sprinkle it on their food so they can digest their food properly. But we're not really going to get into pancreatitis at this level. We just wanted to introduce the idea that this particular disease or disorder requires the enzymes to be sprinkled on the food. And anything from the
No, I think we've covered every single thing.
Yeah. All right. So again, we're not going to focus in on the weight loss medication. So if you want to save yourself some reading, there you go.
Yeah.
Take care and see you next week, gang. I think
this week, actually.
Oh, yeah, this week.
See you Friday.
All right. See you Friday.
Bye.
Bye.